Sir, how is the situation and condition of that South Goa MLA?
No, he's stable, absolutely stable. Whatever we are doing as per the SOPs and guidelines that have been given from time to time from Government of India. I just through your medium want to thank all our doctors and frontline people under the guidance of the Chief Minister. We are working day in and day out. What is the back end, what is happening. Our Secretary Health and our Chief Secretary and all our doctors, Dean and our staff of health services and Director Health Services, all of them are working overtime. Actually, they are working to such an extent, I don't think any of us have even imagined that this would be the scale required. Goa, we are doing our best. Comparatively, Goa, I'm in constant touch also with the Minister from Kerala, Madam Shailaja, who is also keeping me posted about what's happening in her state so that we can adopt the best practices. Because Kerala has also been doing, though the cases have been rising, they're doing pretty well in terms of SOPs. Whatever the SOPs are through the MHA and whatever we need, people are losing jobs, people are losing income. We have to ensure that with safety measures in place, how can we revive the economy? Chief Minister will be also making a few statements on his plan on the revival and other things. So in view of that, we have to see that how best the healthcare system becomes a robust system so that parallelly we can ensure that along with revival of the economy, how we are in a position to have the best health system, strengthen the health system, see that if there are any gaps, we fill those gaps and move forward. One thing I can assure you, a lot of people keep writing articles, people talk about various measures that need to be further improved. We take each and every article, each compared to the recovery rate in the rest of the part of the country. All of us have to take precautions, time to wear masks, time to sanitize your hands, social distancing, go out if you require. That is the norms that you need to follow till we get a solution for COVID-19 in terms of either a vaccine or actual treatment and course for COVID-19. Just now we were with myself, Chief Secretary, Secretary Health, were just discussing in general, is that how one should move forward, and everybody is putting their own bit and trying to see that we keep Goa safe and people safe. As long as the mortality is low, overall if you look at it, still the mortality rate is low, and that is something that gives us more, with us. People also should come forward to see that government has made certain guidelines. If you go to Miramar in the evening, you will find people walking without masks as though it's a normal day. I have started wearing masks in the last few days because I move a lot. I move to different places, but I need to take precautions also. Today the Chief Minister also, I told him and we discussed with him also that he needs to take also precautions. It was unfortunate that one of the legislators, because today the legislators also are in the forefront in their respective constituencies. I am also a legislator in my own constituency. I have to see that we take things. I have told my father also, who's 81, in spite of being 81, he attends all functions, all weddings, everywhere, because that's his style. He never lived in containment. But we told him that to be careful because, he needs to take care. So all of us as citizens need to unite. Today is not the time for any kind of a political brownie point scoring. I see a lot of things happening, but I refrain from commenting on anything. But only thing is that we as a team, all 40 legislators, along with all the doctors, along with the Chief Secretary, Secretary Health, other secretaries, Revenue, DIG, all these people of different departments are working in hand. Fire department, all of them are working hand in hand to keep Goa safe. And that's the way forward. We have to look at ourselves, not belonging to any political party, but as Team Goa, and trying to see how to keep Goa safe. The need of the hour today is revival of the economy and keeping Goa safe so that people still, when we talk of revival, we prevent further job losses so that people can survive COVID-19.
One more last question is that, one thing. Now the tourism minister today announced starting of tourism activities, especially hotels.
I am aware of it.
Are you aware? Is it okay? As a health minister?
No, but economy has to somewhere. Other states have already SOPs maintained. We will handle this problem. One side, we'll use FDA to see that we take strict actions against restaurants that do not maintain the SOPs that is passed by the Chief Minister. Second side, we will, as a health department and the Epidemic Act, we will take action for not complying with those SOPs. So, SOPs definitely will be, and I think every hotel will want that there are SOPs in place. Ultimately, no hotel wants that somebody comes, one of the staff or anybody, they don't maintain the SOPs, gets. Department, I think it's a great challenge, big challenge in front of me. And luckily I got the support of the Chief Minister, because of which we are able to deal with the situation. We will deal with it. As hotels open, we want that economic activity to be revived. Same thing, also stringent measures will be taken for violation of any kind of SOP.
So one more thing is that as far as that new vaccine which has been announced by
No,
the
I'm not,
is there your government as a health?
But we will take all it takes to see that we keep the people safe. Both myself and our whole cabinet and the Chief Minister, under his guidance, we are constantly at it. We exchange our thoughts and we deliberate on various issues and take things forward. And I am very happy with the work that is being done by my Secretary Health, Neela Mohanan, and also the Chief Secretary, who has been also very supportive in what we do. And that is the way forward.
कितले पेशंट व्हेंटिलेटरवर राहतात?
व्हेंटिलेटर 3-4 असं आहेत. Not more than that.
राजस्थान जीएमसीची ओपीडी चालू जाता, फुल फ्लॅश ओपीडी चालू जाता.
फुल फ्लेज जावची ना बाबा. फुल फ्लेज म्हणजे ओपीडी चालू जातली, पण म्हाका दिसना आमी संख्याचेर आमी कंट्रोल दवरतले. कित्याक फुल फ्लेज जर तुवें जर थंय लोकसंख्या, तुका खबर आहा की गोवा मेडिकल कॉलेजान लोकसंख्या ओपन केली, त्याच बरोबर नॉन कोवीड पेशंटाची काळजी घेवपाक म्हणून आमी आमचें काम चालू आसा. आमचें काम ह्या तरेन चालू आसा की तुमी अंदाज बी कर, पब्लीक हेल्थ फावंडेशन ऑफ इंडिया, जे आमचे प्रधानमंत्रीचे जे एडवायझर बी आहात ते डॉक्टर श्रीनाथ रेड्डी, त्यांच्या माध्यमांतल्यान स्वास सखीचो आमी जे लॉन्च केल्ले, रिस्की प्रेग्नन्सीजचे तेंचे लक्ष थंय ट्रेनिंग तेंचे चालू आहा. व्हर्च्युअल ट्रेनिंगच्या माध्यमांतल्यान आमचे लोकांक आमी ट्रेन करपाचो आमचो प्रयत्न चल्ला. हांवें आतांच आमच्या डीनाक सांगलेलें आसा की युनिव्हर्सिटी ऑफ कोलंबिया आनी युनिव्हर्सिटी ऑफ अटलांटा आमच्या नर्सिसांक कोवीड ट्रेनिंग दिवपाक थ्रू देम एक वेगवेगळे तरेची गोष्टी आमची चालूच आसा. कम्युनिटी हेल्थ असिस्टंट